There have been, regrettably, 108 people who have died from COVID-19, including another death overnight, a gentleman in his 70s. Number of cases confirmed in the 24 hours to 12 noon is 279, of which 273 are in Victoria. There have been 5 cases diagnosed in New South Wales. 2 of those individuals were in hotel quarantine and had acquired their infection overseas. 3 local cases were confirmed who were household contacts of one of the people who contracted COVID-19 in southwest Sydney. 7,728 people have recovered from COVID-19, and in terms of current hospitalisation, 67 people are hospitalised and 17 of those are in intensive care units. We have a very specific message today which has been shared with us by our New South Wales Health colleagues and their Chief Health Officer, Dr. Kerry Chant. Anyone who was at the Crossroads Hotel in Casula in southwest Sydney between the dates of the 3rd of July and the 10th of July, anyone who visited that particular venue, you are required to self-isolate until 14 days after your visit. Furthermore, if you are at that particular pub between the 3rd of July and 10th of July, you are strongly encouraged to get tested regardless of your symptoms. This is because that venue is currently the hub of the public health investigation into the small cluster in southwest Sydney emanating from the Crossroads Hotel. It is critically important that if you were there during those 3rd of July and the 10th of July, that you get yourself tested, once again, in this case, regardless of symptoms. So whether you have symptoms of a cough or cold or not, but you are at that pub, do get yourself tested. That includes people who have now left New South Wales, but who may have been at the pub between those dates. Hence, we're making it part of this national press conference, including freight drivers, because that is a particular venue that is also frequented by people who do transnational freight driving. If you are one of those drivers, whatever jurisdiction you're in, do go and get yourself tested. Minimise your contact with others for the 14 days after your visit to the Crossroads Hotel in Casula. This is a timely reminder that infectious diseases of any sort, particularly ones of pandemic potential, highly infectious ones, do transmit through or do travel through transport hubs. And the Crossroads Hotel in Casula is on the Hume Highway, of course. That is not to say that people can't frequent those venues. Of course you can, within the restrictions that the state governments have put on numbers of people and density. But people need to be very cautious. Certainly if you have any symptoms of a cough or a cold and you're on the road, don't drop into the roadhouse and sit down and have a meal. Obviously, do things like get a takeaway. If the place looks full, move on to the next venue. These are just important basic things that we are all going to have to do with COVID-19, with the COVID-19 epidemic. So with that in mind, I'm happy to take some questions.
Border closure, given that this virus is likely to be around for potentially years to come, is there an alternative to dealing with outbreaks to the sort of lockdowns we're seeing in Victoria and border closures? And do you think the measures that we're seeing in Victoria, are they really sustainable in the long term if a vaccine is not available in the next couple of years?
So I guess the first thing to say, and one of the positives, is that an immense amount of human capital is being devoted towards developing a vaccine, including a vaccine that is going to...
Most people are saying that's a couple of years off, probably. Is that fair?
I'll just finish the answer, including the vaccine that was that has recently gone to human trials from University of Queensland. So I think you're quite right. I think that there needs to be some degree of preparation, as I said yesterday, for an Australia that doesn't have a vaccine. So we hope for a vaccine to come as quickly as possible, but it may not come for many months. In that sort of situation, it is the case that movement restriction and decreasing mixing of individuals is one of the main weapons that we have against COVID-19. But the key, of course, will be to get this under control, and it won't last for many, many months. This will be brought under control by the movement restrictions that Victoria has imposed in Greater Melbourne and Mitchell Shire. We know that because once movement gets to decreases to a certain level, and this has been the case in any situation of a second wave around the world, that the numbers eventually start to drop again. The key after that, of course, is to make sure that community transmission stops, that there are no cases of unlinked community transmission, and that we do our best to maintain the security of our borders through hotel quarantine and so on and so forth. So I think rather than suggesting that we will necessarily have a period of several months or years where we have lockdown after lockdown after lockdown, I don't think that's necessarily going to be the case at all. I think the focus is to get this particularly large, significant outbreak under control in Victoria, and then go back to what we do best, which is contacting, tracing and eliminating small outbreaks.
So that would be an unsustainable way to deal with it in a sort of medium-term basis over more than a year, is to continually lock down places where there are outbreaks.
No, I don't think it would be fair to say that that was an unsustainable way to deal with it. The reduction in movement, the reduction in mixing of people is something that is our main tool to deal with COVID-19. What I don't think we should suggest is that there will be outbreaks of the extent that we've seen in Victoria that would then necessitate the sort of stage 3 restrictions and the border closures that we've seen in response to this outbreak.
Dr. Coatsworth, given that we now know that people can catch this virus and can transmit it even if they're not showing any symptoms, what's the current advice around asymptomatic testing? And would you like to see that in more broadly across Australia, especially in New South Wales, given that we're now trying to work out if this Victorian outbreak has moved across the border?
So one of the challenges with COVID-19 is this asymptomatic period, and it's probably better characterised as a pre-symptomatic period before which you'd start to develop symptoms, but you're nonetheless infectious. And that informs our national testing and contact tracing guidance, of course. That's why we ask who have you been in contact with for the days before your symptoms arose. The likelihood of people who are truly asymptomatic transmitting the disease is not known. The reality from the Victorian experience that we've seen is that there have been many, many thousands of tests conducted on asymptomatic individuals for very little yield. When I say yield, very few positives out of the asymptomatic testing that's been conducted down there. So your biggest bang for your buck is still to focus your testing on the symptomatic individuals. That is still going to be the way that you detect most of the cases of COVID-19, and that's still going to be the way that you get control as quickly as possible. The asymptomatic test has a role in places where there's local small clusters. So the Casula case is a very good example. So we don't want to miss any cases in that sort of scenario. Therefore, we're going to recommend asymptomatic testing. There wouldn't be any value to go elsewhere in New South Wales or in Queensland where there was no COVID-19 and test people with no symptoms. Frankly, it'd just be a waste of a test. So that's the difference. That's the nuance behind asymptomatic testing. We will use it in situations where we absolutely want to guarantee that we don't miss anything, and that will be in the small cluster like we've seen in South West Sydney.
On masks, I know that you recommend people in Melbourne, if they can't socially distance, to wear a mask. What is the threshold, though, for other cities or areas? For example, with Casula, would you be recommending people there wear a mask considering there's concerns about an outbreak there? Just a bit of your thinking behind when we get to that point that it's necessary.
I understand. And what I understand more broadly as well is that people are looking for thresholds at which we make decisions. very hard to provide that because if you get to a given threshold, you might be heading up the curve, you might be heading across, or you might be heading down the curve. And there's various situations, various other contextual matters that we need to take into account that are not just the numbers. The New South Wales Health Department has recommended an increase in personal protective equipment for their hospitals in those local health districts around Casula. So that's a good example of where we're increasing the personal protective equipment use. For community mask use, I think you've seen that our switch occurred when Victoria clearly had significant community transmission. And so the recommendation remains the same. We watch to see what's happening with community transmission, and if it is significant, as it is in those areas of Victoria, we recommend mask use. Masks are part of a suite of measures, like we've always said. There is a tendency, and there are those who we might even describe as mask messiahs, who would put a lot of faith in the ability of the mask to control these outbreaks. We accept as the AHPPC that they have a role. We also know that the main game in controlling COVID-19 is movement restrictions and social distancing.
Dr. Coatsworth, how concerning is the situation in Sydney more broadly for you and for the committee? The Premier says that the state is at a crossroads, that southwest Sydney could become a hotspot. What would it mean if the two biggest states both had significant outbreaks for the rest of the country?
Well, I think the answer to that is unavoidable. It would be a very significant event for the rest of the country. It would be a very significant event for New South Wales, were it to move towards the outbreak of a scale as it is in Victoria at the moment. So we share the concern of the New South Wales Premier. That's why we're meeting on a daily basis to discuss the strategy, to assist the Chief Health Officers of both Victoria and New South Wales in developing that strategy and ensuring, most importantly, that those small spot fires that have occurred now in southwest Sydney are put out as quickly as possible.
Was it a mistake for Scott Morrison to go to the football yesterday, given that while it's allowed in Sydney, it's national leader and the message that's been given to Victorians is to stay at home?
The Prime Minister leads the country, and the Prime Minister has been very clear, as we have at the AHPPC, and as you asked in your first question, that we will need to be able to live with COVID-19. Live with COVID-19. Do the things that we enjoy doing in states that we're able to do it in, where the restrictions have been lifted. The PM's a fan of the Sharks. There are a lot of fans of the Sharks and other footy teams who are going to the footy at the moment. The PM was demonstrating quite clearly to Australians that we can gather in a COVID-safe way, in a COVID-safe environment, and get on with our lives. So I have no problem with it at all.
Dr. Coatsworth, just on the changing advice around, or the changing evidence in schools and transmission among young people, what's the AHPPC's current understanding of the way the virus moves through children and in schools?
Well, I'm not sure we're at the point of saying that there's changing epidemiology amongst school students or with regard to child-to-child transmission. The overwhelming evidence around the world is that children are less affected by COVID-19. There tends to be less onward transmission, and therefore schools are safer from a COVID-19 perspective than they are compared to influenza, for example, where school children are the main transmitters. This question clearly has arisen more recently with the Victorian outbreak, mainly from the Altaqua school, but not exclusively. There have been other schools that have experienced outbreaks. What's happened there is that there have been cases of COVID-19 in very young families in the suburbs of Melbourne, very large families in some cases. Many of those children go to the same school, and then that's how those cases get into the school. There has been teacher-to-teacher transmission, there has been teacher-to-child transmission. It's more broadly reflective of what's going on in the community than what's actually going on within schools. The most detailed investigation that we have in Australia at the moment is the one that was conducted in New South Wales. That provided a lot of reassuring information that there's very little onward transmission from children to other children. Just to finish that off, because I think it's important to frame that in light of the school closures in Victoria, which is primarily about, as I said before, the reduction of movement. As we heard today, there's 700,000 Victorians that will move around to get their kids to and from school. We also know from the Israeli experience that part of their second wave was driven by older students towards the end of their schooling, gathering before and after school. So it remains the position of the AHPPC that the classroom itself is safe. It's the other things that occur around school that need to be restricted in Victoria at the moment.
What's your advice to federal politicians and staffers that are in Victoria and needing to come to Canberra for work? I know we saw Victorian ministers here this week. We're all being told not to move, but some people still are. Have you given specific advice to?
So it's the Australian Capital Territory, of course, has its own Chief Health Officer, Dr Karen Coleman, and I know Karen's been in close touch with the Australian government, parliamentarians. It's critically going to be an important issue with the next sitting of Parliament, of course. There are essential things that need to keep going. And as we said earlier, how do we live with COVID-19 into the future? Well, we're going to have Parliament sitting at some point. I can't give you the specific advice for what's going to happen in August at the moment. That's a matter for Dr Coleman and the rest of the Australian government. But suffice it to say that in a democracy, our Parliament does need to keep sitting.
What's the situation along the New South Wales-Victorian border at the moment? Do you have any concerns about the virus spreading across, and what's the take-up of testing been like along there?
I don't have those specific details. That's more a question for New South Wales Health. But as we said before, there are specific issues to do with the New South Wales and Victorian border towns that mean that they're almost being treated as their own bubbles at the moment in terms of the ability of people to cross for essential services, for work, for medical care, and there's certainly high test availability across those border towns.
How many COVID cases have been identified through the app?
How many COVID cases have been identified through the app?
Yeah.
The app doesn't actually identify COVID cases.
No, well,
it identifies
contacts. Through there where people visit the doctor, get tested. How many people have cases have been identified initially through contacting these people through the app?
Well, I'll just repeat what I said before. The app doesn't actually identify or diagnose the case. I think what you're saying is that how many actual contacts have been identified by the app that haven't been identified by the contact tracers.
That have then tested positive, yes.
So, well, you can't test, I had to argue with you, but you can't test positive unless you've already been in contact. So I think the question is, how many have we actually identified on the app as unique contacts? So there was one case in Victoria that was identified during contact tracing that then, on further inquiry by the disease detectives, was proved not to be a significant contact. So that's the one case that has been identified by the app. Let's look at the underlying premise here. The more people that download the app and have it activated, so that's a critical thing. We accept that there's a difference between the 6.5 million downloads and the number of people that actually have it activated at any one time. The COVID Safe app will remind you if it hasn't been activated, because it'll come up every 48 hours and say that it hasn't detected any contacts. So what we would ask of people, whilst we accept that there have been issues with battery life and other things to do with the app, it is a reality that the battery life is not going to be important as the life of yourself or someone else. And there has been good independent modelling that was released by the Sachs Institute a week and a half ago, suggesting that if all Australian smart users downloaded the COVID Safe app and obviously had it activated, that there will be a 50% onward reduction in cases. Based on the current number of downloads, if everyone has it activated, there'll be a 25% reduction in cases. So whilst there's a significant debate about masks at the moment and the relative benefit that that would have, I would suggest to you that if you are a supporter of mask use, you must also be, based on the modelling, a supporter of downloading and activating the app.
Disappointing, underwhelming results. So, like, the public is really told that, you know, this is going to be a key piece in the armour to fight COVID, and there's been, you know, very few cases or people identified through it that are of interest.
Well, I'll answer that question and then I'll let your colleagues have a go as well. Look, the time that the app was implemented was a time when our contacts were we seldom contacted strangers. And once again, we're asking Victorians not to mix with other people. The value of the app, of course, is when you're in contact with someone who you don't know, at close contact, for 15 minutes, and you don't remember when you think back over the 14 days prior. So because both our cases have been low and we essentially haven't been mixing as much, it's not a big surprise that the app hasn't identified those cases. As numbers go up, then the app can come into its own. The contact tracers are still doing such a good job in Victoria at the moment that that the app is not identifying any more cases than they're actually identifying. Testimony to the fact that they're on top of their contact tracing and they're doing a great job.
Dr. Coatsworth, if New South Wales risks some kind of outbreak or potentially going in the same direction as Victoria, is now the time for people to start thinking ahead about maybe limiting their movements if possible, or taking other steps to protect themselves and other people?
Well, I think that there's a balance here, and that the people that we look towards are always the chief health officers of the individual jurisdiction. So we should look towards Dr Chant, Premier Berejiklian, and what they're telling New South Wales residents to do. And there's no movement restrictions for anyone beyond those who have been at the Casula pub between the 3rd of July and the 10th of July being suggested at the moment. But obviously that's a very important thing for New South Wales residents and ACT residents to keep an eye on in the coming days. And I'll just take one more question.
Yeah, sure. Just given the rise in the number of hospitalisations we've seen over the past week, and we've now seen a few extra deaths in Victoria, what would you, what's your concern around our death toll rising significantly in coming weeks, given the large outbreak we've had in Victoria?
Well, deaths are a reality of COVID-19. They're a reality of a pandemic. It is possible that the death toll will increase. There's no doubt about that. And the avoidance of what we've seen overseas, which are large numbers of deaths, particularly in elderly members of society, is precisely why we take the measures that we're doing at the moment. We had to do it in February and March. We're doing it again. We have, however, learnt a lot. I mentioned yesterday that we have amongst the best intensive care doctors and nurses in the country. That extends to other healthcare workers, emergency physicians, emergency nurses. But right at that pointy end at intensive care, what have we learnt? We've learnt that dexamethasone is an effective drug to reduce mortality in COVID-19 by a significant percentage. We've just recently improved remdesivir, which will have an additive effect. We know a lot more about how to treat patients. We know that patients with respiratory complications from COVID-19 actually do better if you...
We have been hearing there from the Deputy Chief Medical Officer, Dr Nick Coatsworth in Canberra, with an update. 279 new cases across the nation in the last 24 hours, 273 in Victoria, 5 cases in New South Wales. And of those cases, 3 are linked to a household in the Blue Mountains.